Hey everybody, Dr. Warren here with Apex Spine Joint and Wellness on this cold winter day. I want to share a couple things with you, and that is on re-examinations and follow-up with your chiropractor. So many offices I see, they have no objective follow-up with their patients throughout the course of care. Whatever the recommendations are, it's like, here's the recommendation, then you got to do it. And there's no follow-up in between. There's no, how's it going? Are you getting better? Do we need to change the game plan? Do we need to pivot and shift and go a different direction? And in my clinics, what we always do is halfway through the treatment, if it's a longer treatment protocol or program, or towards the end, if it's shorter, we follow up with the patients. We have them fill out a re-examination form. I'll show you here in just a second. I diligently look at those every day after the patients have filled them out. Every single day. The girls bring them, they leave them on my desk. I review all of them to make sure we're getting results. I want to see a minimum of 50% improvement, okay? And we strive for that. It's something you need to look for when you're looking for a chiropractor. When do we follow up? Do we re-look at that? If they show you a problem on their x-ray and say, hey, well, we need to get this straight or we need to fix this curve. Okay, are we going to take a follow-up x-ray? There has to be objective data when you follow somebody through the course of care to prove that they're getting better. The proof is in the pudding, as they always say. And does your chiropractor have that? Do they have something? Do they give you an opportunity to sit down and fill something out to communicate with the doctor? Are you getting better? Does the doctor re-sit down with you and do a follow-up? One of the most brilliant orthopedists I know in Denver, Colorado, if you go there and have any type of procedure done, in 6 weeks, he has a Zoom call with you to follow up with you on how you're doing and what your progress is. We never want to put somebody into a system blindly and just hope they get better, okay? So I want to show you that form now. So this is that form, okay? Towards the end of care, this is a very short visit, very short plan, excuse me. Just 8 sessions of soft wave and decompression is what that means, okay? This patient came in with sciatic pain, shooting down the legs, some numbness and tingling. We determined that it was a bad disc, okay, at L5-S1. This patient was very hesitant to go to the chiropractor because they've had so many bad experiences. And that's the thing that we see. The average person that comes to see me has seen 1 to 2 chiropractors already. And I always ask them, hey, well, you're coming to see me now, so why aren't you at the other one? And they always say it was too expensive or they didn't get the results, okay? So we want it to be affordable one, and we want people to get the results. Okay, so comes in with the lower back. He's reporting that it's 75% better. Okay, pain doesn't stay, not as frequent, overall just feels better. Any of the symptoms remain? Yes, after a long period on the feet. So that tells me as the provider for this that the strength is just still not there. And here we go. Have you been doing the exercises? Yes and no, I haven't been doing them consistently. Okay, so like with this patient, we may just need to strengthen that area up a little bit. Classifies his improvement as good. It's easier to walk, sit, stand, bend, work, and work out. Everything is now easier to do. Some other improvements that may have taken place that they may not associate with this, but has every implication. Stronger, better mood, digestion. This patient reports after starting care that their digestion got better. Well, it makes perfect sense because when the nerves down low are really hyper, those nerves also control to the digestion tract. They can have some effect on that. Most chiropractors will tell you it's the cause. No, it can be, but it's definitely a factor, okay? No concerns, okay? He's doing so well, we give them an opportunity to see if they're wanting to do maintenance and where they think they kind of fall in versus what my recommendation is. My recommendation for this patient was twice a month, so we're on the same track. Something like this has to be done. Absolutely has to. It's not a maybe or I think it's better. This has to be done. So you're keeping objective data on your patients. So you're monitoring them that they're getting better. So they have the opportunity, okay, to communicate with you on if they're getting better. Must be done. Always look for a chiropractor that monitors you objectively when going through care.